rheumatoid arthritis is just a joint disease. True or false?
That's false. Rheumatoid arthritis is a systemic disease. Systemic means that it can affect many other organs, and it does affect the eyes. It can affect the brain, it can affect the heart, it can affect the lungs, and it can affect the skin and even the kidneys. Motion is lotion. So if they continue to walk or swim or dance, they will maintain the function of the joints. They will preserve the strength of their joints. And every single chapter that I put in the book, it starts with a story of one of my patients for a purpose, because those were things that people reported, we did changes, and we saw the results.
Okay, hello and welcome. This is your host, Dr. Chhaya Makhija, and I am delighted, thrilled, and honored to introduce our guest today, Dr. Deanna Girnita. I wish I had drum roll, but in short and brief, she is very, very well known as the world-renowned rheumatology expert, with being the founder and CEO of her first telehealth practice in the country called Rheumatologist on Call. She's the only physician that I know who's dedicated to making arthritis and autoimmune care accessible to telehealth, and also has like a prime focused on integrating lifestyle, integrating integrative medicine, as well as science-based facts, data in her care. Her passion is rheumatoid arthritis, but she's also written books on journals for rheumatoid arthritis, her book on gout, and today she is going to share a lot of insights on her recently published book on rheumatoid arthritis. Thank you, Dr. Girnita.
And thank you so much, Dr. Makhija. It's a pleasure to be here. It's an honor to meet and chat with you and talk about lifestyle. I know this is a topic that is also your passion.
Absolutely, yes. You're one of those pioneers who's brought, the science as well as lifestyle together and educating our community or the world in general, even on your YouTube channel. So please give us, a brief summary of what you're passionate about, anything about your profession, and then we'll go through some rapid fire questions, debunking myths about rheumatoid arthritis, and a deep dive into this topic.
First of all, I'm a rheumatologist. I am board certified in internal medicine and rheumatology. But like any physicians, we have a passion, and my passion was rheumatoid arthritis. I have treated over the last 15 years, probably thousands and thousands of people with rheumatoid arthritis. I also diagnosed many of these people. And I did notice that those people that were incorporating certain things in their lifestyle will do much better on medication than others. And in many cases, we were able to taper down medication and even stop some of the medication. So that took me on a journey to understand what is different about these people. And coming from a world of science and digging into science, I started to dig and try to understand how lifestyle will bring benefit to our traditional world of prescribing medication. And I've seen the two extremes. I've seen people that were trying to go only on medication, not changing anything in their lifestyle. And I've seen people that were trying to go only on lifestyle or only on trying supplements and getting as much as they could away from the medication. And in many situations, those things do not work. So the purpose of this book and the purpose of this talk will be to show people that there is a way to unite these two worlds. Whatever you do every day in your lifestyle will impact your disease, will impact your risk to develop one disease or multiple diseases. And the fact that we have some tools, we have medication, is not against what you are doing day by day in your lifestyle. So this is all about.
Yeah, it seems like it's going to be very comprehensive where you're bringing two worlds together. Impressive. So, your first rapid fire question is rheumatoid arthritis only affects older people? Yes, no, or any one liner statements?
No, rheumatoid arthritis affects the both, affects the young people and affects the elderly people. And actually, I have seen people at any age affected by rheumatoid arthritis. And there is also a subset of patients develop that when they are children. So we call that juvenile idiopathic arthritis, but it's also a form of rheumatoid arthritis. So that's a misconception that only elderly people have arthritis.
Thank you. The next one is you can't live an active life with rheumatoid arthritis. True or false?
That's a misconception. I actually encourage all my patients to remain active and to incorporate any sort of exercise, anything that will bring them pleasure and will keep those joints moving. I actually tell them that motion is lotion. So if they continue to walk or swim or dance, they will maintain the function of the joints. They will preserve the strength of their joints. So 100% I encourage everyone with arthritis, any type of arthritis, to keep moving.
Okay, motion is lotion. Wow, that's going to be one of our takeaways today. Your next one is once you start medications for rheumatoid arthritis, you'll be on them for life.
That's not true either. I have seen patients that will decrease the doses of medication, and I have seen patients that they stop the medication. However, I don't encourage anyone to stop it without talking to their physician. There is more and more data coming out, and I actually have seen this weekend a study that was recently published that people that were stable on certain medications, like biologic medications, and people that know about biologics, about rheumatoid arthritis, those people, once they were stable, after a while, they are able to taper down and get rid of the medication. We're just scratching the surface to figure out which are those people, what differentiates them, but it is possible to stop the medication at some point.
How impressive is that? Yeah, I mean, the possibilities is mind blowing that you're just sharing with us. Your next one is rheumatoid arthritis is just a joint disease. True or false?
That's false. Rheumatoid arthritis is a systemic disease. Systemic means that it can affect many other organs, and it does affect the eyes. It can affect the brain, it can affect the heart, it can affect the lungs, and it can affect the skin and even the kidneys. So, rheumatoid arthritis, it's a disease that needs to be treated because if you let or if you don't care about the joints, you should care about your heart. And that's what I tell my young patients. If you don't care about how your joints will look, or if you don't care that you're not going to be able to use your hands, or, some people, they get very, very sensitive when they look at the pictures of people with rheumatoid arthritis that we had from 20, 30, 40 years ago. And I tell them, if you don't care about your joints, you should care about your heart, because the heart will also be affected, and the cardiovascular risk, if you don't treat rheumatoid arthritis, it's increasing to 2 times or 3 times or 4 times in 10 years of disease.
Mm-hmm. Yeah, that is very powerful, because the inflammatory markers. Yeah, so well said. We should definitely touch this on our deep dive questions. Thank you. Your last one is there's nothing you can do to prevent flare ups. It's just random. True or false for rheumatoid arthritis?
I think there is a lot that we can do to prevent multiple flare ups. I don't know if we can prevent all of the flare ups. But now I'm coming back to the lifestyle. I think that what you do in your everyday life will impact your risk to develop multiple flare ups. And I'm going to give you just one example. And patients with rheumatoid arthritis, they do know that when you go for a lot of ice cream or a party and you eat certain things that they have more sugar, more alcohol, that will precipitate the risk to increase that number of flare ups.
Mm-hmm. You touched a very sensitive point for people's sugar. And in the last 2 weeks, I've interviewed specialists from all fields of medicine. And one common takeaway was there's nothing with sugar, and specifically, we're talking about processed sugar, is good for
That's absolutely correct.
every flare up, be it in endocrine field, rheumatology field, even in reproductive endocrinology, fertility, cardiovascular. It's a fact. It's a fact, and I think no one can argue about it, like in terms of disagreement. So thank you. So now, Dr. Gurnita, please share, about this or robust information that you have in your book called "Thriving with Rheumatoid Arthritis," which is such a hopeful. It has an empowering message. And if we can go back, like what inspired you to write this? Like who is it truly for, and who is this truly written for by you?
So the book is written from my experience working with patients, and it shares a lot of the stories of my patients. If I can look back and I could tell you who inspired me, I think are the patients that I had over years. And those patients, they taught me lessons, very important lessons that I had to, validate and then apply. And then I have been able to see that doing certain things consistently by many other patients will bring relief in terms of pain, stiffness, and will also take patients from using multiple medications to only one medication. And if I have to coach a patient that comes to me, because a lot of patients, they come to me with this hope to get rid of all the medication, I would start the conversation with, let's get rid of most of the medications, because when you take multiple medications, of course, your lifestyle is impacted by that. Of course, the risk of side effects is higher. And if it is one medication that you should take and you should feel okay, would you be willing to do that? Or will you be willing to be just on medications? And patients love that. So, just by doing certain changes, you can achieve a better lifestyle, a better goal, and yes, the goal is to get rid of the medication, but that shouldn't be the primary goal when the conversation happens.
Sure. So, when you're talking about these patient experiences, can you share a few simple, impactful lifestyle or even mindset shifts from your book that can help someone who is either newly diagnosed with rheumatoid arthritis or currently seeking the right expertise for rheumatoid arthritis?
So, one thing that people have to understand is that every single patient is different. So, what works for some people might not work for others. But as a general rule, I think you already touch on something that is very important. I tell patients that there are a couple of things that you have to keep in mind. One of them is what you eat, because what you eat is gonna impact how you feel. And if we have to restrict our huge knowledge about foods into a couple of categories, the things that I would remove first will be anything that has added sugar, like you said. And then the second thing, I would try to remove gluten, but not all the patients will be sensitive to gluten, but many will. And even if they're not carrying celiac disease, the gluten sensitivity is powerful enough for some patients to notice a decrease in their joint pain. The other thing is that it's also important is to remove processed foods. Anything that is processed, anything that is in a box, it's clearly not natural. Then I teach patients what they should eat, because once you remove certain things, you have to understand what you should eat. And I teach the patients to go, instead of going to the aisles full of boxes, to shift their mindset and go to usually it's in the back of the store, to those areas where you find the legumes, where you find the vegetables, where you find the fruits. They don't have a label with multiple ingredients. You don't find that there. So if you don't find that, that's generally something that you should eat. And the other thing is, we also touch on that, is movement. Movement is very important for people with rheumatoid arthritis and any kind of arthritis. Another very important mindset, it's about how you think about your disease, because if you have that perspective that everything is dark, this is done, you're sentenced to a very chronic disease or an autoimmune disease, if you have that perception, you put a lot of stress on your mind, a lot of stress on your body, and also, your mind is connected to your body. So what I do with my patients, I coach them about what they should do to shift that mindset. And it's either simple things, like you mentioned that journal. Write 3 things that you are grateful for every single day. That changes the mindset. Stop complaining, finding solutions instead of complaining about your problems. That brings you to the next level of changing the mindset. And then I teach patients about how to do, for example, breathing technique. It helps them tremendously to go through pain. And I also teach them how to assess their pain, how to not fight the pain and understand where the pain comes from. So all of these are changes in their mindset about how they look at the disease itself, how they look at pain, because pain it's also a very powerful trigger for anxiety and for depression. And if you don't manage that, or if you don't know how to manage pain, you're going to end up with more anxiety or more depression. And if you don't know how to manage that, there is that vicious cycle that you're going to end up with more pain. And the last thing that I talk about frequently with patients, and it's in the book, it's about the power of sleep. I did not understood how powerful sleep is until patients will tell me, I had a rough night and the next morning I felt horrible. My joints were hurting. And initially I didn't took it as, a connection is there. I thought, maybe it is, maybe it isn't. But then when I read about the science of sleep, I started to understand how sleep is connected with more inflammation. And those are the things that I bring with science. So everything that's in the book, everything that I practice is based on scientific value. And it's also implemented for years in the lifestyle of my patients. And that's how I've noticed that changing things, small things like improving the sleep or the sleep pattern will help my patients. And every single chapter that I put in the book, it starts with a story of one of my patients for a purpose, because those were things that people reported, we did changes, and we saw the results of those changes.
How impressive is that? Yeah. You touched base on very important essential components. So your nutrition, and I'll get back to nutrition specifically because of the gluten, or eliminating gluten for these individuals. The second one, what you had also mentioned, was movement, or motion is lotion, during your initial discussion. The third one was perspective, right? So more positive perspective, and or you already have a resource of the gratitude journal for patients with arthritis or rheumatoid arthritis. The breath work, which is also very much universally accepted as improvement in our well-being. I talk to my patients about the parasympathetic nervous system stimulation and how that helps in reducing their cortisol and adrenaline rush, so the fight and flight response, and the sleep, right? And how that's contributing to the inflammatory process for RA. So, going to the first aspect, which was nutrition, this is more, now as in our endocrine world versus, how it happens or how it impacts the arthritis, specifically rheumatoid arthritis. Are there any scenarios where patients are eliminating gluten, but then reintroducing only certain aspects which are absolutely unprocessed or in more of a pure form, and that has helped them to incorporate in their routine and still not have flare ups? Like, is there any possibility, or do you have any of your patient stories?
I think a lot of the gluten sensitivity comes from all the processed foods that they have consumed over years. And once they eliminate those processed foods with gluten too, they will feel so much better. I have many patients telling me that they had not only less abdominal pain, less bloating, less episodes of diarrhea, like more GI stuff, but they tell me that they have more energy besides pain. But they have more energy. They feel like they can sleep better. They can do more things, which is absolutely rewarding. And it gives them the drive to continue to eat less processed food or less foods with gluten. From time to time, I tell them to reintroduce certain things, like you are saying, because I feel like not always the gluten is the problem. It's the combination of things. But reintroducing certain foods, it gives them the understanding if that is causing the problem or not. So again, the perspective is to work with every patient to see how ready they are for a change and what is their level of understanding of what we say, because that's the other thing. We can say a lot of things, but if patients do not follow what we say, it doesn't really matter. And if we don't do it in small steps, patients will not follow it either. Because if I give a patient a list of 10 things to do, they will not do it. Or they will do it for a week, 2 weeks, 3 weeks, and then they will stop because it's too hard. Changing habits, I think, is the hardest thing that we can do.
And that's where, your book, as well as I'm pretty sure your expertise, is helping them coach step by step. Amazing. So, in your approach for patients with rheumatoid arthritis, it definitely sounds unconventional and not, the typical traditional route of just focusing on prescription medications, but more of a a holistic approach, which is also scientific. So, what's the book providing in terms of for patients in terms of guidance as to how they should be talking to their specialist about medication as well as incorporating these lifestyle interventions? Any tips for your readers?
I think the book unites the two worlds. As I begin the conversation, I tell patients that one world should not exclude the other one. They should complement each other because there is a lot of values in science, and the scientific evidence is there that certain drugs that we have today, they really change the history of rheumatoid arthritis. If I look back 30 years ago, when I was a medical student, actually, there was nothing in my country for rheumatoid arthritis other than gall salts and prednisone and maybe methotrexate. We did not have access on any biologics. And even when the biologics started to be on the market here in the United States, and even today, there are countries and people around the world that do not have access to this kind of medication. So we should take advantage of this, therapeutic advances in our world, but we should also be very focused and conscientious that our lifestyle is what brings us to certain diseases or will increase the risk to develop certain diseases. And even if in the book I say we cannot change our genetics, but we can change what we do every single day. We can have that choice of what we put on the plate. Of course, we cannot change the genes that we inherited from our parents, and we may have that. But if you are a patient with a high risk for rheumatoid arthritis, and if you smoke a lot, or if you eat a lot of crappy food, or if you have a very disorganized lifestyle, then your risk to develop this disease at a younger age is higher. So, and it makes a difference because if you are developing rheumatoid arthritis in your 20s versus in your 70s, your quality of life for 50 years was great compared to your quality of life being so much worse starting in your 20s and being dependent on medication. So it makes a difference how long we can push that onset. If we can push it to forever, that will be ideal. But it makes a difference if you have rheumatoid arthritis in your 20s or if you develop it in your 50s or if you develop it in your 70s.
What I'm taking that is as prevention, right?
Absolutely.
So if we have a disease, how can we prevent complications, deformities, pain? We don't have it. If we have this background inheritance, how can we prevent having the diagnosis of it?
And the other thing is I don't want people to be afraid of side effects of the medications. And I tell that all the time to my patients. Majority of my patients do not have side effects. It's not only because I take care of them, because I'm involved in their care constantly, but it's because the majority of patients do not have side effects. And usually those patients that do not have side effects, they don't go on the internet to complain that their disease is doing great. Or they say, usually people that they have a bad experience with a doctor, with a treatment, they will be the ones that will go and will tell the world that they had that bad experience. But I don't want everybody else to take that experience and think that is going to happen to me because the big chunk of population or the big numbers of population that are on these medications are not experience side effect. And with the proper guideline, with someone on your side to coach you about what is best for you, what can work for you, and with your choice, because that's the other thing. I let my patients choose together with me what I think will be best for them. I'm there to tell them what I think is best for them, but ultimately I let my patients to decide what they want to try.
Absolutely. Such a amazing shared decision making process that you just described. Yeah. And they're not buying fear from the internet because they have this one-on-one expertise, the coaching that you talked about. Amazing. So, Dr. Granita, if individuals, I think anyone in the world listening to this, if they had to get your book, Thriving with Rheumatoid Arthritis, where can they buy it from?
They can find it on Amazon.com. It's available there. And I'm very happy to share that we sold more than 1,000 copies in about 3 months.
That's impressive. Yeah. I'm sure, every individual who has a family member or they're dealing with this disease or have a strong family history should benefit from reading this book. Impressive. If patients, if people, or if anyone dealing with rheumatoid arthritis had to seek care from you or from your practice, where can they find, how can they reach you?
They can find me on rheumatologistoncall.com. This is the website. And they can also benefit from a lot of the free resources that I share on my YouTube channel, which, carries my name or the name of the practice, Rheumatologist on Call.
Yes, please go ahead and follow this. I usually share every patient with an autoimmune condition or there's a family history. You're the resource that I would just share with them rather than having them read the guidelines because that's more medical jargon as much as
Thank you so
the
much.
visual and information that you provide. Thank you so much for being with us today and sharing insightful and amazing wealth of knowledge in the world of rheumatoid arthritis. Thank you, Dr. Girnita.
Thank you, Dr. Makhija, for inviting me. It was a pleasure to be here.
Same here.